You may remember Melody Zilke, who had bariatric surgery at the DMC with Dr. Michael Wood. Well, we're visiting with her again because Melody's bariatric surgery was just the beginning.
When I had the bariatric, it really did help me because of the fact that it shrinks the stomach size and the intake of your food. The big adjustment is trying to get used to eating smaller portions, slower, but it's worth it.
Worth it indeed. Melody took advantage of her new eating limitations, and it paid off.
Within a year, I had lost approximately 120 pounds and kept it off and went back to enjoying life.
But there was a lingering issue, and it was a big one for Melody. She experienced sagging skin, not as severe as this bariatric patient, but cumbersome nonetheless.
I exercise 6 days a week faithfully, and the skin gets in my way. You know, you work so hard at it, and it's not going to go anywhere. It just, it's stretched out for over so many years. Where is it going to go?
And where was Melody to go? Back here to the DMC and Dr. Bruce Chau.
Who knows a thing or two about sagging skin and specifically removing it, which is called a tummy tuck.
Is this fairly commonplace for people who undergo bariatric surgery to have to go back for?
Basically, yes, we all want to remove the extra skin so that they can look better, the clothes fit better.
Right.
But oftentimes, the amount of skin is so excessive that the skin become problem. What kind of problem? Well, hygiene problem.
Right.
Because of the moisture, they get smelly. Sometimes they get the yeast infection. Sometimes they're so low that it's becoming a problem with walking. So I think that there's a combination of a functional issue and also a combination of aesthetic issue.
So what were your options?
Tummy tuck. They basically give you options as far as do you want a full abdominoplasty versus a body lift versus lipo.
Abdominoplasty is used when the sagging skin is mainly in the front of the body. The surgeon makes an incision from side to side and removes the skin from the front of the body. This allows the skin and muscles underneath it to be tightened up. The body lift, or belt lipectomy, is used when there is sagging skin in the back of the body as well as the front. A 360-degree incision allows the surgeon to pull the skin up like a pair of pants to tighten the whole body. Liposuction can be used in conjunction with these procedures to remove excess fat.
Every patient is different. Here's a look at Dr. Chau determining how much skin needs to go on this other bariatric patient.
We are going to remove this amount of skin. This is going to come all the way up to here. We want to take away this skin also. So if you imagine, this will be the amount of skin that we'll be removing. So I'll just do one final check. Perfect.
Perfect for her, but what would be best for Melody?
Melody did lose a significant amount of weight, but fortunately with her body type, she didn't have as much sagging skin as some other patient that I've seen. She had your traditional abdominoplasty, which on the street known as a tummy tuck, or it does consist of two parts. One is to addressing the excessive skin that she has, and then the other part is to tighten up the abdominal musculature.
It was very simple. They went in, they removed the excess skin, they tightened the muscles underneath so that I can get that six-pack abs if I wish.
Patients are very, very happy to suddenly they wake up, the skins are gone. And that's a very, very gratifying type of surgery you perform for this patient.
I'm ecstatic. I can't really explain in words. I look better, I feel better. I think that says it all for me.
Visit us here at dmc.org to learn more about safe plastic surgery techniques or to make an appointment with Dr. Bruce Chau and his fine team here at the Detroit Medical Center. Or call 888-DMC-2500. I'm Emery King.